As a medical assistant, you are responsible for recording aspects of your patient's medical history and preparing for and assisting with a patient's physical examination. The medical assistant gathers and records identifying information and may obtain part of the medical history from the patient. Then vital signs and height and weight are taken. In addition to recording data, the medical assistant prepares the exam room before the examination, sets up needed equipment, prepares the patient both physically and mentally for the procedure, collects specimens as requested, and assists the patient and the physician as needed during the procedure. The objectives of this video are to describe methods for taking and recording a brief medical history or a statement of the patient's chief complaint, and to illustrate methods for setting up the physical exam equipment and positioning and draping the patient.
From time to time, you may be asked to take a patient's history. A history offers a physician valuable diagnostic information of the patient's overall well-being. Included in the history is the patient's chief complaint and a history of the present illness, the patient's past health history, and the patient's family health history. Also included is a disclosure of the patient's social and occupational history, which includes a description of lifestyle and any habits that may affect the patient's health. The final part of a patient's history is a review of systems, or ROS, which is a review of specific body systems. This review is used to reveal subjective symptoms that either the patient forgot to discuss or seem relatively unimportant to the patient. When you first meet, identify the patient and yourself. Provide a quiet, private environment for the interview and explain the history-taking procedure. Successful interviewing begins with your attitude toward the patient.
What I'm going to do
Be
is
calm
just take some
and take your time.
past medical history from
Think
you,
of the interview
and
as a
afterwards I'll give
conversation.
The doctor, let him review it. And then
Encourage the patient to give specific information. Besides medical problems, personal data such as stresses at home or work can help identify factors which may affect the patient's health.
what exactly brings you in to see the doctor today? The reason?
Well, I've been having this lower back pain.
Ask the patient about his or her symptoms with questions that answer what, where, and when.
And how long has this been going on for?
It's been 3 weeks now.
If the patient is complaining of pain, ask for the location and description of the
So the worst
pain.
pain that you get is just up the
Watch
left
his
side.
facial expression and other body language as he points out the pain. Ask when the pain first occurred and if there is a special time or activity which seems to bring it on. Ask how long the pain lasts. Note what pain medication, if any, the patient is taking.
If I'm on my feet for a long time or I sit for a long time, if I make a sudden motion, I get a sharp pain on the left side.
Listen carefully to the patient and pay attention to his voice. Note if his voice sounds anxious, upset, or intense with pain. Listen for offhand comments such as, "I probably have this pain because I'm under so much stress. I really shouldn't be here at all." Assure the patient that he has made the right decision in coming to the doctor. Alert the physician to the patient's
It
comments.
doesn't hurt to have the doctor.
He or
take a
she
look
may
at
be
it.
able to discuss the problem with the patient more thoroughly.
Is there anything that you'd like to add before I go ahead and give this to the doctor?
Summarize the information that you have recorded and ask if there is anything he would like to add. Show interest in a patient's questions. If you cannot answer a question, refer it to the physician. While the patient is waiting for the physical exam, you may wish to explain some of the exam techniques that will be used. This patient teaching helps the patient relax. The physical exam differs from the history in that it involves a thorough examination of the patient from head to toe. Beginning from the head and working downward, the physician examines each body system or part for function. The chief complaint, as stated in the patient's history, determines the extent of the physical exam. Sometimes, only a specific examination of one body system or part may be necessary. Other times, a complete head-to-toe systematic examination is needed. In preparation for the patient's physical exam, the medical assistant is responsible for preparing the room and for the setup of the necessary equipment. Check that the examination room is comfortably warm, well-aired, and spotlessly clean. Wash your hands. Place a clean cover over the examination table and a towel or cover over the pillow. Extra towels and patient drapes should be on hand for necessary use. Place a step stool near the examination table in case the patient needs it. Again, thoroughly wash your hands before setting up the required physical examination equipment. The type of equipment needed by the physician will depend on the specific physical exam procedure. A general physical exam may require a tape measure, a tuning fork, an ophthalmoscope, a flashlight, an otoscope, a laryngeal mirror, a neurological pinwheel or safety pin, a percussion hammer, a stethoscope, thermometer, tongue blades, a blood pressure cuff, alcohol swabs, cotton balls, a urine specimen bottle, tissues, disposable single-use exam gloves, and a waste container. Instruments for special exams may be added to the general physical setup or used individually. These instruments may include a proctoscope, a vaginal speculum, and uterine sponge forceps. When setting up the instruments, make sure that electrical and battery-operated equipment and all lights are in working order. Place the equipment so that it is conveniently located for the physician's use. You are now ready to assist the physician with a general physical exam. A female assistant must remain in the room if the patient is female and the physician is male. Your presence helps an anxious patient relax and also protects the physician from unwarranted lawsuits. Always ask the patient to empty his or her bladder before the examination begins. Instruct how a urine specimen is collected if one is required. Wear disposable single-use exam gloves when handling specimens and properly label the specimen. Place it in a specimen refrigerator until you are able to send it to the lab. Wash your hands. Take and accurately record vital signs, blood pressure, and height and weight. For a complete physical examination, ask the patient to disrobe completely and to put on a gown with the opening in the front. Request the patient to sit on the edge of the exam table with a towel or chucks under her buttocks. Place a drape over the patient's lap. After taking all the necessary recordings, such as the vital signs, and once the patient is ready, call the doctor. Give the patient's chart to the physician before the examination begins. Depending on the physician's preference, you may be requested to stay in the room to hand instruments to the doctor as they are needed. Frequently, the physician performs a specific physical examination which requires the patient to be placed in a particular position. Positioning the patient allows the physician better visibility of and accessibility to an area during the examination. The position chosen depends on the type of examination or procedure to be performed and on the patient's age, sex, and physical and emotional condition. Most of the positions are uncomfortable and difficult to maintain for any length of time, so it is important that the patient is well supported.
Ms. Taylor, I'm just
Drapes and a gown are used to protect the patient's privacy, to provide some comfort, and to avoid chilling the patient while in a given position. Draping and gowning a patient allows only the examined part of the body to be exposed. The patient should only be exposed when the physician begins the examination.
When pelvic, bladder, or rectal exams are given, the patient may be placed in the lithotomy or dorsal recumbent position. Ask the patient to lie on her back with her legs separated and knees flexed. The drape is placed on a patient so that it resembles a diamond. One corner between the patient's legs, a corner at each side of the examining table, and one corner at the neck. In the lithotomy position, the feet are supported in stirrups, which may or may not be raised approximately 12 inches from the table level. The buttocks should be positioned at the edge of the examining table. When a patient is in the lithotomy position, the side corners of the drape sheet are wrapped around her legs and placed under the heels of the feet, which are supported in the stirrups. This is important for longer procedures for patient comfort. For the dorsal recumbent position, the soles of the feet are placed flat on the table and the buttocks are brought as close to the edge of the examining table as possible. Arms are placed either across the chest, along the sides of the body, or crossed under the head. When the physician is ready to begin the exam, pull the corner of the drape toward the abdomen to expose the perineal area. Place the drape corner neatly over the patient's abdomen. Do not allow the drape sheet to fall over the perineum, as this would obstruct the physician's view. For vaginal, prostatic, or rectal exams, the knee-chest position may be used. Ask the patient to kneel on the table, keeping the buttocks elevated and the back straight. Place a small pillow under the chest for comfort and support. Turn the head to one side. Extend her arms and place them under or near the side of her head. Place the drape sheet as a diamond over the body. Place a smaller sheet over the legs. When the exam begins, pull back the drape sheet and fold it over the top of the buttocks. The Sims, or left lateral position, is frequently used for rectal exams and for vaginal exams on older women who are unable to maintain the lithotomy position. Instruct the patient to lie down on the table and then roll over onto the left side and chest. Position the patient's buttocks near the edge of the side of the exam table. The left leg is slightly flexed and the right leg is sharply flexed. Place the left arm behind the patient so that the body is leaning slightly forward. The right arm remains in front of the body for comfort and support. Place a small towel or chucks under the buttocks and cover the patient with a drape sheet. As the examination begins, fold back the drape corner so that only the anal and vaginal areas are exposed. Other positions used during a physical exam include the supine position, prone position, and Fowler's position. In the supine position, the patient lies flat on her back with arms placed at the sides and the head slightly elevated on a small pillow. In the prone position, the patient lies flat on the abdomen, arms flexed under the head, and head turned to one side. In the Fowler's position, the patient sits up at the side of the examining table.
When the physician has completed a physical exam, it is a medical assistant's responsibility to provide for the care and comfort of the patient. If lubricant was used on the patient during the exam, provide the patient with tissues to remove any excess left on the body. Wearing disposable exam gloves, remove any soiled linen from under the patient's buttocks. Allow the patient to rest in a supine position for a few minutes before getting up and assist the patient as necessary. Ask the patient whether or not she has any questions and inform her of any special instructions. If necessary, help the patient to dress. Otherwise, leave the room to provide privacy. Inform the patient if she is free to leave, or if required, to check at the front desk to schedule further appointments. After the patient has left, collect all used equipment and supplies, wearing disposable exam gloves. Remove linens and place them in the soiled laundry container. Place disposable equipment in a covered waste container and take instruments to the cleanup area. Depending on the instrument and its requirements, rinse with cool water or wash or soak it in soap and water. Be sure to follow universal precautions. This readies the instrument for sterilization or disinfecting preparation. Clean the examination table and put on a fresh cover. Resupply equipment as needed. If smears, cultures, or urine specimens were obtained, check that they are properly labeled and that the appropriate laboratory request forms are filled out. Send them to the lab. Remove your gloves and wash your hands. Chart required recordings completely and accurately. Some of the skills you must acquire as a medical assistant were demonstrated in this video: taking a patient history, setting up equipment and the examining room, positioning and draping the patient, caring for equipment and obtaining specimens are important duties of the medical assistant.